So the next POM audit is around improving the quality of valporate prescribing. So really three kind of main objectives here. One is to assess kind of reasons for documentation for prescribing. So really looking at the reasons, and that's important because valporate can be prescribed for a number of different things. Within mental health services, we use it often for as a mood stabilizer, and going forward, it's important that clinicians know why it's prescribed so that they can look at how to assess it appropriately. The next thing is that assessment of kind of side effects, of adherence, of therapeutic response. And then the third thing, which is probably the most pertinent and important thing at the moment, is around prescribing for women of a childbearing age. So valporate can potentially have devastating effects for women of childbearing age, so women who are pregnant. And as such, there is a national pregnancy prevention programme which we need to be adhering to. So just going through some of the results. So overall, we're pretty much at the national kind of baseline with all these things. So documentation, the majority, there is room for improvement in terms of documenting why valporate is prescribed. Assessment of side effects and therapeutic response, etc. Again, we're mostly compliant, but there's room for improvement. And the third bit around kind of women of childbearing age. Nationally, again, we comply nationally, then we're not great at this. So firstly, that whole prevent program, there's no reason for it being inapplicable when valporate is prescribed. Where it is prescribed, where that prevent program is in place, to be fair, people do pretty much comply with the process. So where there is improvement, like Tolu and Cam have mentioned, it's just around kind of sharing and that kind of education.
Thank you, Arjan. Thank you.